At present, we can see that there is a large increase in the cases of depression. Because of the current economic and political downturn, some depressed patients are starting to turn to smoke to relieve more stress. But smoking is not the solution to the stress problems because cigarettes are tobacco consumed with nicotine, the addictive substances found in all species of tobacco. When the smoker is exposed to this substance, it will make the heart beat faster, causes high blood pressure, causing narrowing of arteries. It also contains at least 60 types of carcinogens and more than 4,000 chemicals. Negative effects of cigarettes: risks of ruptured cerebrovascular disease, risks of lung and respiratory disease, risks of gastrointestinal disease, risks of various cancers and physical symptoms, risks of bone and muscle disease, risks of urinary tract disease, risks of cardiovascular disease, chance of permanent blindness, pregnant women at a risk of miscarriage, sexual dysfunction. Substances in cigarettes. One cigarette contains 4,000 chemicals, which hundreds of substances affect functions of various organs in the body and contains 43 types of substances that are carcinogenic. Nicotine is extremely toxic, can be absorbed through the skin and mucous membranes of body and is an addictive substance. This substance initially stimulates the brain and the central nervous system, raises blood pressure, heart and pulse rate faster. This may increase to 30 beats per minute, causing the heart to work harder than usual and stimulate interstitial peristalsis, but in the later stages, it will have a depressant effect on the nervous system. Nicotine and other chemicals that causes the bad fats in the blood to rise, narrowing of blood vessels, which can cause coronary heart disease and higher blood pressure. Tar or bitumen contains many chemicals that have carcinogenic properties, with 50% of tar trapped in the lungs when smokers breathe in air that contains various particulate matter. Tar substance in the lungs will combine with the dust that is inhaled, then catch the accumulators in the lung air sacs, causing irritation, which is the cause of coughing and sputum and causes lung cancer and a long-term emphysema. Carbon disulfide causes thickening and a hardening of the secondary arterial walls. Carbon monoxide is the same combustion gas that is emitted from automobile exhaust pipes. This gas impedes the oxygen transport of red blood cells and makes the smoker get oxygen less, at least 10 to 15% for those who smoke heavily. The body has to make more red blood cells, which makes the blood thicker and more viscous. The heart has to beat faster and work harder to allow the blood to bring enough oxygen to the parts of body. If there is a large amount of the gas, the tissue is starved of oxygen. Hydrogen cyanide causes coughing, phlegm, and chronic bronchitis, headache, dizziness, nausea, and vomiting. It is a poisonous gas used in war. The nitrates in the cigarettes produce this substance. It is an inhibitor of many respiratory enzymes that causes metabolic disorders in the heart muscle and walls of blood vessels. Nitrogen dioxide causes emphysema. It will destroy the epithelium of the trachea and the air sacs. Nitrogen oxide makes the heart beat faster, called palpitations. Ammonia is used in flavoring and helps nicotine to be absorbed into the brain and the central nervous system faster. It has the effect of irritating the tissue, causing burning eyes, burning nose, and bronchitis. Cyanide, if taken in large quantities, it can cause paralysis of the heart and stop breathing, usually used as a rat poison. Benzene is found in pesticides. It may be attached to tobacco leaves as a carcinogen. Diseases caused by smoking. Three main diseases caused by smoking. Cardiovascular disease. Cardiovascular disease are a group of disorders of the heart and blood vessels. Heart attacks and strokes are usually acute events are mainly caused by blockage that prevents blood from flowing to the heart or brain. The most common reason for this is buildup of fatty deposit on the inner walls of blood vessels that supply the heart or brain. Strokes can be caused by bleeding from a blood vessel in the brain or from blood clots. Lung cancer. Lung cancer is a cancer that forms in tissue of the lung, usually in the cells that line the air passages. It is the leading cause of cancer death in both men and women. There are two main types, small cell lung cancer and non-small cell lung cancer. These two types grow differently and are treated differently. Non-small cell lung cancer is a more common type. Chronic obstructive pulmonary disease or COPD. Chronic obstructive pulmonary disease refers to a group of disease that cause airflow blockage and breathing-related problems. It includes emphysema and chronic bronchitis. COPD makes breathing difficult for 16 million Americans who have this disease. Millions more people suffer from COPD but have not been diagnosed and are not being treated. Although there is no cure for COPD, it can be prevented. Methods and techniques for quitting smoking. Set goals and motivation. Clear goals or a motivation for quitting smoking. You can write on the wall about why you want to quit smoking, for example, for family, work, or health. Quit smoking with lemon. Use lemon as a help by taking the peel of the lemon, cut it into small pieces, carry it with you. When you feel the urge to smoke, pick up the lemon slowly and suck it up. And chew the lemon peel and swallow. According to research, lemons contain vitamin C, which has a substance that helps reduce nicotine cravings. And in the majority of people who quit smoking with lemons, it was found that they quit smoking within 2 weeks and would reduce their urge to smoke again. Smoking cessation diet. Eating can also help reduce the urge to smoke. The foods that are suitable for people who are quitting smoking are as follows. Fresh milk, which helps to reduce the amount of smoking because drinking fresh milk will help make the taste of cigarettes worse. Green leafy vegetables. The greener the better because the vegetables are green, which will have the effect of not wanting to smoke and also have chlorophyll, which is antioxidant. Eggs, chicken breast, and nuts are the food that produce serotonin that will make smoking cessation easier. These 3 foods were introduced by the University of Massachusetts that is suitable for those who want to quit smoking. Chewing gum. Try picking a piece of gum and chewing it when you feel like smoking. This method has both people who say it works and doesn't work, but try it won't hurt. Dispose of all smoking equipment such as lighter, ashtrays, etc. to cut off the power from beginning. Will not accidentally pick up and smoke again. If activities are done to attract attention when you have an urge to smoke, whether it's exercising, playing a game, or watching a movie, anything that distracts you from picking up a cigarette. Seek advice from reliable sources, whether from a doctor, expert, or a call line, or a quit line, or the smoking cessation clinics in general hospitals. Drug treatment. Nicotine comes in 2 forms, patch and a gum. Can be used in combination with both forms or in combination with other drugs. Depending on the patient's condition, oral medication are divided into 2 types. Champix stimulates the brain instead of nicotine to release chemicals and will block nicotine from acting on the brain using this drug. Patients will have time to settle in quitting smoking. There will be no redness, but to see result, patient must see the drug for at least 3 months in a row. QMM is usually an antidepressant but medically found that it can be used to quit smoking, therefore used in people who want to quit smoking, which must be eaten continuously for at least 3 months. But in people who smoke a lot, doctors may use all kinds of drugs to help patients quit smoking successfully.
Depression treatment. Eliminate sadness without smoking. The main treatment in this disease is antidepressant therapy, especially in the case of severe symptoms. In the case of few symptoms, physicians may help to guide the way of looking at problems in a new light, ways to adjust or finding something that helps the mind relieve the suffering, along with additional antidepressant or anti-anxiety medication when deemed necessary, treatment with antidepressant. Currently, we cannot cure or treat depression on our own. If you start to feel that your life is not normal, lacking balance, high stress, seeing a psychiatrist is like checking your mental health for us to understand your mental state at that moment. Your doctor will suggest ways to prevent and improve your mental state by adjusting your thinking or treating with medications because of psychological problems or behavior that has changed. It is not caused by depression alone. Seeing a psychiatrist will help us get right treatment. Self-healing depression symptoms, not a cure. Number 1. Meditate, because even just a few minutes of meditation a day can help us enter tranquility. Number 2. Exercise. Regular exercise increases endorphins in the body, boosts energy, elevate your mood, and increase your sense of self-worth. Number 3. Have a reliable group of friends. A group of friends who are good friends, listen to care, help each other, have happiness together, have a fight with each other. Because of the fact that we have a group of people to support us, we can cope with stress and mental illness. Number 4. Find a hobby to do. Hobbies are often things that we love to do. This will help draw attention away from negative emotions. So if you feel stressed or depressed, you should find a hobby that you do so that you can concentrate on it. Number 5. Get expert treatment. Sometimes we may encounter things that we are out of control. We therefore need to rely on a specialist. who can advise and diagnose our symptoms accurately. This will help us to relax until we can return to normal life, which we can consult at 1323 24 hours a day. Most importantly, it is a free service from the Department of Mental Health. Number 6. Love yourself. Loving yourself is one of the most effective ways, but not widely used. The reason is that very few people are taught to love themselves. Self-love is not selfish, but mercy and goodwill to ourselves. Number 7. Eating foods that contain substances that reduce stress. The first food example is salmon, as it is high in omega-3, DHA, folate and vitamin B12, which can help reduce symptoms of depression. Coffee and green tea. Coffee contains the substances known as caffeine, which reduces risks of depression. Green tea contains L-carnitine. It keeps your brain fresh and focused. Shellfish foods are full of vitamin B12, which is important for building neurotransmitters and helping to reduce stress. Bananas, papayas, dates contains tryptophan, phenylalanine and leucine to boost serotonin, a neurotransmitter that helps regulate sleep. Feeling calm helps suppress anger and aggressions.
Electronic cigarettes are a type of smoking device which uses electrical mechanism to generate heat and steam containing various chemicals without the smoke from the combustion process like regular cigarette. It consists of three main components: a battery, a vaporizer and a heat generator or atomizer, and a solution. The part of the liquid that is vaporized and enters the smoker's body consists of the main components: nicotine, propylene glycol, glycerin. Nicotine are also found in the electronic cigarette and found many compounds in vapors of electronic cigarette that are said to be harmful to the body, such as heavy metals, arsenic, formaldehyde and benzene. That from research, it was found that electronic cigarette smoking increases the risk of developing diseases such as heart disease, causing DNA changes in the cells of the lungs, heart and the bladder, which increases the risk of cancer. Of course, electronic cigarettes contain nicotine, which is a substance that causes addiction. Therefore, smoking electronic cigarettes can make smokers addicted, just like regular cigarettes. In addition, the style and the procedure for e-cigarettes are very similar to that of conventional smoking, causing smokers to remain addicted to smoking habits like regular cigarettes. Therefore, smoking electronic cigarettes does not reduce regular smoking. Worse still, the overall rate of smoking, both conventional and electric, has increased even further. This is partly due to the same nicotine presence and especially in youth, being part of smoking group no matter what kind it starts with. Eventually there will be an exchange. Experiment within the group until familiar with all form because interchangeable as they are interchangeable. Now in the United States it has banned cigarette companies from advertising that e-cigarette can help quit smoking because it contradicts the research data. In law, electronic cigarette is a prohibited produce. Person who has e-cigarettes in possession, it is an offense for both the importer, the seller, and the user. When the officer sees an offense in front of them, can be arrested. In the case of an importer, imprisonment for not more than 10 years or a fine of 5 times the value of the imported goods, or both. In the case of sale, imprisonment for not more than 5 years or a fine of not more than 500,000 baht, or both. In the event that a person smokes or has an electronic cigarette in his possession, that a person is guilty of possessing an illegally imported item, punishable by imprisonment for a term not exceeding 5 years or a fine of 4 times the price of goods including duty, or both.